To fast-track access to health care for all residents, the Lagos State Government, through the Lagos State Health Management Agency, LASHMA, has engaged over 800 healthcare providers at the 2025 edition of its ILERA EKO Annual Provider Forum, a health-level stakeholders meeting held in Lagos themed Driving Universal Health Coverage Through Strategic Partnerships serves as a platform to review progress, deepen collaboration, and unveil far-reaching reforms aimed at strengthening Lagos' health insurance scheme. In his keynote address, the chairman of LASHMA board, Dr. Adebayo Adedewe, hailed the resilience and dedication of health care providers, describing them as the bedrock of the ILERA EKO scheme.
Every patient encounter is an opportunity to empower someone with access to affordable health care. And to support this, ILERA EKO Academy continues to assist healthcare providers with client enrollment and training, building capacity across the ecosystem. Additionally, I am pleased to announce the upcoming launch of LASHMA Aid, a specialized emergency healthcare intervention which is developed to address life-threatening situations for our relief. Preparatory stakeholders engagement have commenced, and I am excited to inform you that the official rollout will take place in the coming weeks.
In her remarks, Permanent Secretary of LASHMA, Dr. Emanuela Zamba, disclosed that enforcement of the mandatory health insurance policy in Lagos would commence in 2026 following the executive order signed by the governor in July 2024. Zamba revealed that the agency has grown its network to over 865 empaneled providers, while also transitioning claims, vetting, and service authorization from third-party administrators to an in-house team. Meanwhile, stakeholders have reaffirmed commitment to building an inclusive, efficient, and sustainable healthcare system.
Now, social health insurance is mandatory in Lagos State. Enforcement will start in earnest early next year, as was mentioned during the program. But this is a period for us all to be aware, to ask the necessary questions, and to generally join this bandwagon, because universal health coverage anywhere in the world that it has advanced is usually by compulsion. And that means that everybody now has to key into it. Because let us face it, government cannot do it alone. There are people within our community that cannot even afford to pay 1 naira for care. Somebody has to pay that money. Government is paying that money on their behalf, but of course government cannot do it alone. So all of us have to contribute to this pool, and then we'll be able to take care of even more people. People are assured that they will not be financially impoverished if illness comes visiting.
And really the key driver here is to leave no one behind, is to make sure everyone is cared for, especially the vulnerable. So this forum today brings together all the stakeholders involved in this to ensure that we all on the same page, to celebrate the providers, and also to see what we are doing going forward to ensure that this program is part and parcel, of the fabric of Lagos State and the health of the indigenous.
Lagos State is the leader. You set the pace. We work in other states, and we also take some of the learnings from Lagos to implement in our other implementation states. And aside from that, the Healthcare Federation, which I'm now honored to lead, is, as you know, is an advocacy body. So it's not just the providers, it's the community pharmacists, it's the lab technicians, the manufacturers, and so on and so forth. And we believe that the private sector still has a significant role to play.
I think we still have a lot to do and to learn, even from neighboring countries. Just about 2 weeks or maybe last week, about 2 weeks ago, we were somewhere and they were saying, okay, Ghana, it was NHI saying that Ghana has achieved 70% coverage of health insurance. So what are we waiting for? That means it is doable, it is feasible, it is profitable, and we are going to work towards making sure that it happens here in Lagos State and in Nigeria as a whole.
Hello, hope you enjoyed the news. Please do subscribe to our YouTube channel and don't forget to hit the notification button so you get notified about fresh news updates.